everybody. I am so very happy to be here. My name is Melinda McGuire, and I am a social worker with the Dempsey Family Education and Resource Center over at Riverside Hospital in the new big Silver Neuroscience Tower. And I know that you all just got through either exercising if you're a participant, or maybe you're a caregiver and you just got done with lunch. And so in order for you to not fall asleep and to not be thinking about getting home and getting out of your sweaty clothes, this is going to be we're going to have some audience participation today, all right? So in front of you, can I borrow yours for a second? You have a little piece of cardboard that has a T and an F for true and false, okay? So I'm going to ask you some true and false questions. The reason why I did it this way is you're going to hold it up and I'm going to be the only one that's going to see your answer. So you don't have to worry that everyone knows that you answered right or wrong. I'm the only one that's going to see it, okay? And so to start out, I'm going to ask a question that everybody's going to get right if you answer it the way I want you to answer it, and that is, I need to know how old you are. So if you, not me, if you guys are 60 or older, hold up the T, okay? So if you're 60 or older, hold up the T. Okay, thank you. So we're going to get started, and truth be told, I thought I had an hour to talk, and then they told me I only had half an hour to talk. My talk today is on community resources, legal and financial issues. So as far as the presentation is concerned, my first true-false question is that community resources are easily accessible to people of all ages. What do you think? So yeah, most of you are getting right. That's false. And so that's one of the reasons why I ask you about your ages, because if you're over the age of 60, there are a lot of really good resources out there for you. If you're under the age of 60, unfortunately, there's not a whole lot out there, but we'll touch on those as well so you know what they are, okay? Because most of the resources are available to those 60 and older, just kind of to touch base, resources can come from federal, state, or community programs. And because of the 1963 Older Americans Act, and this gave older Americans access to services like nutrition services, Meals on Wheels, in-home services, transportation, legal services, things like that. And the way it works is that the federal government gives the state the money, and then the states are supposed to distribute it how they see fit. And so in 1973, they added the Area Agency on Aging to this program, and these agencies are the front door to all services. So anybody in the whole nation can call their Area Agency on Aging in their area, and that agency is supposed to help you find the resources that you need. So here in Central Ohio, it's the Central Ohio Area Agency on Aging in these counties that are listed here, and I also have given you a PowerPoint too. But also some communities have levies. So here in Franklin County, we are very blessed to have a levy program that also offers some additional community resources as well. So, and then also in Delaware County. But a lot of these programs are for people, again, they're over the age of 60, and some of them have income and asset limits that they have, and then also it varies by location. And so I will go over the local agencies with you, but just, nationally, the Administration on Aging and the National Association for the Area Agency on Aging, those are the places that you want to go for national programs that were not listed here. So the next true-false question is, services are comparable no matter where I live. Right, that is false. And mostly because of these county programs that we have. And here in Central Ohio, if you live in Franklin or Delaware County, you are in good, because those two counties have a senior service levy. They have really good services. They have good ways of distributing those services to the people in those counties. If you live in other counties, not so much, unfortunately, but you do have access to the services through the Area Agencies on Aging, just not those county services. So again, these services can include all of these things: personal care, emergency response, homemaker services, respite, home delivered meals, all right? Next true-false question. Some programs are available to everyone over the age of 60, regardless of income. So some programs can be for anyone over the age of 60, regardless of income. And yeah, that is actually true. So a couple of services here locally that we have that are the least restrictive, because it doesn't really matter how much money you make, is through the Central Ohio Area Agency on Aging, they have a caregiver consultation program. They will come to your home, they'll talk about kind of what things you need now, what you might need in the future, how to start planning for the future. And then the thing that I point out the most in my job is this caregiver support program. It's offered in Franklin County, and it is up to $1,000 given to the caregiver to help care for someone. And that can include an aide to come into the house. It can even include, I've heard in the past, like if you're a caregiver and your washer breaks down, you could use some of that money to get your washer fixed, because as a caregiver you need a washer to take care of the person you're caring for. So that is just a phone call to the Area Agency on Aging, and they want to know if you are caring for someone over the age of 60, that you live in Franklin County, and that you are actually a caregiver. So they're going to ask you kind of what kind of things do you do, and even like making meals, doing laundry, taking someone to the doctor and grocery store. You're considered a caregiver if you do all of those things. A lot of these programs, though, have limited hours availability. Like the caregiver support program is only a 3-month program. Once you run out of the money for this programs, you might have to pay privately. And so the next true-false question I have is, private pay agencies sometimes require a minimum number of hours. Do you think that's true or false? It is actually true. So private pay agencies can cost between $20 and $30 an hour. Some of them do have that you have to have the person there a 3-hour minimum. Another good thing that we have here locally, if you don't want to pay an agency, is the Community Care Registry. So that is also through Franklin County Office on Aging, and in order for someone to be listed on the registry, they have to have the background check and go through a workshop and have references. So this is a private individual who meets all of these requirements and is on this list. Now the thing, and so they'll be cheaper, probably $10 to $15 an hour. The problem is they're an individual person, so if they get sick, there's no one, they'll call in sick. There's not going to be, they send a different person out to you. But it is a good way to save money. If you have been in the hospital or if your doctor orders it, you can get skilled home care as well. It's short term. Your insurance will pay for it, but again, it has to be physician ordered. They can also help with medical equipment, but there is some restrictions. If you get a wheelchair, you have to wait so long before you get another wheelchair or a different type of wheelchair. And you should always check with your insurance to see what providers are in network. If you get to the point where you're really having trouble staying at home by yourself, there are some outside of the home options. One is assisted living. It's kind of like apartments with a nurse that'll check on you. They could have aid services. Assisted living, really you're paying kind of a la carte. So you live there and you pay a certain fee, and if you need an aid, you're going to pay an additional fee for the aid, an additional fee for medication administration, things like that. So the next true-false question I have is, Medicare will pay for these care options outside of the home. True or false? Medicare will pay for the care options outside of the home. And you're right, that is false. So if you have long-term care insurance, that will pay. You can pay privately, or there are Medicaid waivers, but Medicare does not pay for long-term care. They pay for skilled care only. And that's really difficult sometimes because these facilities can be very expensive, and people think that, oh, but my Medicare will pay, and that's really not the case. So the next thing I want to talk about in terms of support is just the kind of emotional support you can get from each other. You obviously are in a class where you draw support from each other, but the Parkinson's Foundation also has support groups. They have different programs. I'm sure you guys are all familiar with it. I think that one of the speakers was from the Parkinson's Foundation, but here's the information to get a hold of them. And so my next true-false question is kind of a funny question, and that is that support groups are all touchy-feely and very uncomfortable to be a part of. What do you guys think? It is false. It really is. So you guys, part of a support group is to, be able to talk out your feelings, but really it's about supporting each other in terms of, hey, I had this problem. What did you do to take care of it? And so it's really offering you guys options. So here's some online support groups, and I got on them yesterday, and it really is a lot of discussion boards, again, about I have this problem, how has someone solved it in the past. OhioHealth sponsors a support group at the Gerlach Center right across the road here. We're going to turn to legal issues, and this is where, if you are under the age of 60, this is kind of what you need to listen to. And the next true-false question is, if I still work, I can qualify for accommodations under the Americans with Disability Act. So this is kind of a trick question, because if you are disabled enough, you will qualify for that, but if you apply too early and you don't have much of a disability, you won't qualify. And so if you're working and you need to apply for that, you need to make sure that you really do need reasonable accommodations. And that's what the American Disabilities Act is. It's allowing you to have reasonable accommodations to do your job. Or if you're working and you're under the age of 60 and you just are getting to the point where you can't work anymore, you can also apply for disability. Disability is hard. It's a long-term process to get, and so you kind of want to start early. You have to gather a bunch of stuff, medical records and work history and things like that. But you could also qualify for disability, again, if you're disabled enough. I thought my whole talk today was going to be on advanced directives, and then I found out it was on these other things too. So I have a lot of good things on advanced directives. So my next question is, only someone over the age of 60 or who has an illness needs an advanced directive. And an advanced directive is a healthcare power of attorney or a living will, something like that. So do you think only people over a certain age or with a disability need a healthcare power of attorney? You guys are exactly right. That is not true. Advanced directives, I'm going to talk healthcare power of attorney. What that is it says, if I am unable to make a medical decision for myself, I want to name this person to make the decision for me. Now, it's really important for you to know that that happens only if you are unable to make that decision for yourself. And so if you are cognitive and aware, you can't say, I do want this procedure, and your healthcare power of attorney doesn't have veto power. They can't say, well, no, you're not going to. As long as you're able to make the decision for yourself, you get to do that. And the reason why it's important to have a healthcare power of attorney, no matter what age you are, I say anyone over the age of 18 needs a healthcare power of attorney, because if you don't have one, then the doctors and hospitals go by next of kin. So if you are over the age of 18 and you aren't married, your parents get to make the decision jointly. What if your parents are divorced? What if they don't get along? Again, they have to decide together unless you name one specific person. So what if you're older and say you no longer have a spouse but you have adult children, and they're your next of kin? But it doesn't go in your oldest child gets to decide and then the next oldest. It's the children together as a group. And so it's really better to name one person, and it's better to have a conversation with that person about, this is what I want, this is what I don't want. And it's really important to make sure that person is on the same page with you. So a lot of people might think, well, I'll just make it my oldest son because, the oldest son should make decisions. But the oldest son might not have the same ideas about artificial nutrition or life support as you do. And so it's really important to talk to your loved ones to find out who kind of is on the same page as you in terms of your health, and then name that person your healthcare power of attorney. If you're married, your spouse gets to make that decision for you unless you have a healthcare power of attorney. But if you're married and you separate but don't divorce, your spouse still gets to make that decision for you. So I think it's very important to have. And the reason why I think it's important for even people over the age of 18 is because once a month I help run a traumatic brain injury group. And we have people in there who had a brain injury, in their 20s, and they needed a healthcare power of attorney in their 20s. And so you never know when you need one. So that's important. A living will just is what you want to happen to you if you're in the hospital and two doctors deem that you are in a permanently unconscious state and artificial nutrition isn't helping. So this can say, I want this done, I don't want that done. It's important to have, but really your healthcare power of attorney is the most important, because that person can speak your wishes if you are unable to speak them for yourself. And then of course, the DNR is really for someone who has who is very end of life or has a terminal illness, and that is do not resuscitate. So if someone's heart quits beating, then they're not going to do anything. And really that is a decision that is made towards the very end of life. And part of the healthcare power of attorney section asks about organ donation, so that's something you should think about. And again, talk to your family, because they might not be on the same page as you, so that it's really important that your wishes are made known. If you need help with advanced directives, or also there's a durable power of attorney financial, and it's best to have legal help with your financial power of attorney. So here are a couple of places you can go. Pro Seniors is a local organization that you get one free phone call, and it can last, as long as you need it to. But really, they say one free phone call, but people I've helped in the past, they give you one free phone call and then say, you can email me if you have extra questions. So it's a little more than just one free phone call. And then eldercare.gov is also a place you can go to find free or just cheaper legal advice, okay? So let's talk a little bit about insurance, my least favorite thing to talk about. The different types of insurance, obviously, if you're still working or you've just quit working, you can have employer health insurance or COBRA. If you don't qualify for any of those, the healthcare marketplace is still out there and available. But most people in here probably have Medicare. Some people have Medicaid. If you have nothing at all, most hospitals will help with charity assistance through the HCAP program. Let me find my next true-false question here. The question is, true or false, Medicare and Medicaid are the same thing? And they're really not. And a lot of people get them confused because they're so very close in wording. But Medicare, you're eligible for based on how old you are. And there's different parts. Part A is your hospitalization, that you qualify just based on age, and it's free if you've worked so many hours over so many years. Medicare Part B is your hospital insurance, and you probably have to pay a monthly premium for that. And then D is your prescription insurance, and you also probably have to pay a monthly premium for that. You can kind of combine all three of them together into an Advantage plan if you want to, that can cover all of the things together. And again, there would be a monthly premium. The next question is, true or false, Medicare can be very confusing. It is very, very confusing. The good news is that there's help out there through Medicare.gov and also through this Ohio Seniors Health Insurance Information Program, OSHIP for short. OSHIP is a wonderful resource, and there are SHIP programs in all states, not just Ohio. And so you can call OSHIP, and they can help you kind of navigate Medicare, and then they have volunteers that can help answer questions too. I am a recent OSHIP volunteer, so you can call me and ask me a question, and then I'll say, let me look that up for you, and I'll look it up, and then I'll call you back. I'm not one of those that's good enough to answer it right at the moment, but I know where to find the resource. So OSHIP is a great resource. Medicaid, again, is different from Medicare. Someone told me once the easy way to remember it is Medicaid is aid for people who can't afford insurance on their own. Medicaid might be important to you, as Medicaid is what can help pay for the long-term care facilities if you are unable to. But there is a process that you have to go through. They have made it easier and quicker online, but again, you have to know someone that can help you with that and kind of navigate you through that. So if you want to live in an assisted living facility, but you don't have the money, there is a Medicaid waiver program for assisted living facilities, and it also will help you pay for a long-term care, what we call nursing home facility, if you need that as well. The last one is on veterans. So the question I have, the true-false question I have on this is, all veterans are eligible for all VA programs. Yeah, and this one is false too. So they do have different qualifications if you've served in wartime, depending on how long you served, depending on what type of wartime you served in. But the best resource I can give you for that is this Veteran Service Offices. They can answer all kinds of questions on benefits, and they are just lovely people. I really like to call them because they're very friendly, they're very knowledgeable, they get back to you quickly. So if you are a veteran and you want to know what benefits you qualify for, I would definitely suggest that you get a hold of the Veteran Service Office if you don't know what benefits you qualify for. Okay? My last true-false question is kind of a self-promotion question, and that is OhioHealth has a great resource at Riverside to help you navigate these systems. And it is absolutely true. So I want to tell you a little bit about the Dempsey Family Education and Resource Center. We are in Riverside Hospital in the Neuroscience Tower. We have a nurse that works full-time that can answer questions on health-related issues. And again, I'm the social worker there, and I can help you with your Medicare questions. I can help hook you up with VA resources. I can help hook you up with the community resources through Central Ohio Area Agency on Aging or Franklin County Agency on Aging as well. And I brought resources here. There's a couple of things. There's a book called Older Adults, the Resource Guide. So this has a lot of information, even for if you're not an older adult but you need assistance with housing or food. It talks about where food pantries are. It talks about the HEAP program if you need assistance with your electric or gas bill. So this is a great resource. Again, even though it says older adults, even if you're under the age of 60, it has good resources. And then I know we have some caregivers in here, and the Area Agency on Aging has put together this caregiver toolbox. It talks a lot about community resources. What I really like in it is it has a section on how to help safely transfer someone from the bed to the wheelchair or help turn them in bed. And they do a series each month at the Dempsey Center called the Caregiver Toolbox. It is the third Thursday of each month, and I have some flyers for that over there as well. And then we offer some great community programs, art therapy, music therapy, a communication group. We're getting ready to start a neuro yoga program, which when I leave here, we get to go practice yoga today, so I'm excited about that. And I offer a caregiver support program. So I want you guys to reach out to me. That is the one thing I forgot is my card, but the information is on the PowerPoint, and the number is up here too, the 788-6115. We want to be available to you. If you don't want to stop in, you can just call and say, hey, can you mail me resources on whatever you need, and we can help you find those. So I talk really fast, so I got done in half an hour. I got my whole hour presentation done in half an hour, and I'm available to answer questions. So Medigold is one of those Advantage plans, and the thing about Medigold and all Advantage plans really is that you have to use their providers. So Medigold actually is a provider for a different healthcare system here in Columbus. So probably if you want to come to OhioHealth, it's going to be out of network and you're going to pay more. Yeah. That's the thing with Advantage plans is they can limit who you can see because they are sometimes associated with a certain healthcare provider. Yeah. You can switch, not that you have to, but you can actually switch your Advantage plan and open enrollment each year if you want to. Yeah. I really do want you to reach out to me if you have any questions. Look over the PowerPoint and say, oh, she talks so fast through that, I missed that. Give me a call and I can go over it with you. Anything else? Thank you guys very much. I'm glad y'all stayed awake.